Welcome to Community Partnerships Helping Everyone Learn Prevention, a series designed to help inform, educate, and prevent abuse of alcohol, tobacco, and other drugs and related consequences, such as interpersonal violence. In this segment, we'll discuss youth medication abuse, including what it means to misuse or abuse medications, how youth are abusing pills, and what you can do to help prevent medication abuse by youth. So let's get started. Medication misuse and abuse are serious problems across the nation. In fact, the Center for Disease Control has called prescription drug abuse a public health epidemic. Missouri is no exception to this epidemic, as nearly 10% of Missouri high school students have abused prescription drugs at least once. According to 2014 Missouri Student Survey data, Greene County has an even higher rate of prescription medication abuse, with almost 12% of Greene County high school students reporting having abused prescription medication. The U.S. Food and Drug Administration, or FDA, describes prescription misuse as when a person takes a legal prescription medication for a purpose other than the reason it was prescribed, or when that person takes a drug not prescribed to him or her. Medication abuse, on the other hand, is using a medication, whether prescription or over-the-counter, for recreational use or to get high. Medication abuse is very risky, as safeguards like doctor oversight and recommendation from pharmaceutical companies are ignored, and medications are often taken in larger doses to intensify the effects. This is a dangerous practice that has cost young people their lives. Both over-the-counter and prescription medications can be abused by young people. Over-the-counter medications are drugs that can be purchased without a prescription from a doctor. Over-the-counter medications typically abused by teens are cough and cold medications that contain dextromethorphan, or DXM, which is a common cough suppressant. DXM is relatively safe when taken in the recommended dosage, but abusers often take a great amount more than the recommended dosage in order to get high. At this dosage, there is a very real possibility of damage to the liver or other organs. DXM is the most commonly abused over-the-counter medication, but teens might also misuse or abuse pain relievers, pseudoephedrine, caffeine, and diet pills. The three categories of prescription drugs commonly abused are narcotics, sedatives, and stimulants. Narcotics are painkillers like Oxycontin, hydrocodone, or Demerol. Sedatives, or depressants, like Valium and Xanax, are used to treat anxiety and sleep disorders. Stimulants, like amphetamines and Ritalin, are used to increase alertness, focus, attention, and energy, as well as to help treat behavior disorders. All medications have potential side effects associated with their use, but these effects can quickly become dangerous when medications are not taken under the supervision of a doctor or when taken differently than prescribed. The dangers of medication misuse and abuse increase when multiple medications are abused or when the user drinks alcohol. It is important to take the warning labels on medications seriously and follow instructions as directed, since many of these medications can be addictive if misused or abused. In fact, research shows that 4 out of 5 heroin abusers began by abusing prescription drugs before moving on to heroin as their addiction progressed. There are several factors contributing to the increase in medication abuse by youth. One is that youth find medications easy to obtain, as 64% of Missouri high school students say it is easy to get over-the-counter medications, and 35% say it is easy to get prescription medications. Nationally, 8 out of 10 teens who have abused prescription painkillers say that they got the medications from a friend or a relative. Along with the easy access to these pills, the false belief that medications are safer than illicit drugs also contribute to the problem. Missouri Student Survey data shows that 14% of Missouri high school students see little risk or harm associated with abusing prescription medications. The lower the risk of harm, combined with easy access, creates a greater likelihood that youth will abuse medications. In closing, here are some tips to help you prevent medication abuse by youth. Model proper use of medications by reading the label each time you take a medication. If you are doing this in front of your children or teens, read it out loud and take it as recommended to model the healthy way of taking those pills. Never take a medication that does not belong to you or take it in a different dose than recommended. Keep track of your medications so that you know if any are missing. Keep your medications locked up so that they are only accessible to you. Properly dispose of medications that are unused or expired. You can visit our website for locations of disposal sites. Have a conversation with your child regularly. When parents talk to their child about the risks of drug abuse, youth are up to 50% less likely to abuse drugs. Unfortunately, less than 1/3 of parents have these important discussions with their children. Thank you for watching Helping Everyone Learn Prevention, an alcohol, drug, and violence prevention series developed by your Regional Support Center, Community Partnership of the Ozarks. If you'd like to know more about this program or other substance abuse and violence prevention efforts, contact us at 417-888-2020 or visit the web address on your screen.